Hi everyone, and welcome to Meet the Team with UEA Mental Health Nursing, and I'm with Ros. As way of an introduction, Ros was my personal advisor throughout my training, and she survived. But it was interesting, before we were starting, you were sort of rewinding your life, and I think a really interesting point and a good place to start is, when did you first think about, I want to be a nurse or a mental health nurse?
So I come from a family of nurses, third generation, and all through my childhood and teens it was like, oh, you're going to be a nurse like your parents, and I was like, no, can't do that, not going to do that. And I didn't know what I wanted to do. Joined sixth form, walked out 3 weeks later.
Hold on. So when you said, "What, I'm not going to do that," was that based on you'd sort of observed something that you thought, nursing isn't for me?
I think I had a different perception of nursing than what the reality was, despite my parents doing it.
Yeah.
And it just felt like it was an expectation. Oh, you're going to be a nurse, like your mum and your dad and your granddad, you know, that kind of thing. So I went to sixth form and realised I had no idea what I wanted to do, had no motivation, and said to the teacher, I don't want to be here, and he said, you don't have to, so I left. And after various things, I ended up working in a factory, assembling video recorders, and thinking I can't do this all my life. And at that time, my mum was LD nurse and then went into teaching LD nursing, and she'd talk a lot about it, and I realised it was a very different thing to my perception of nursing in general, right, which was sort of very influenced by what you see in the media about mostly adult field.
Yeah.
And I thought, I could do that. And because I'd grown up around the place that they worked and the people that they worked with, I thought that's actually just working with people that I've grown up with. Yeah. So I did LD nursing. I applied to do LD nursing and really enjoyed it. And spent 10 years working in LD, mostly with children and a respite care unit, but I did some community work as well.
Okay. And then somewhere along that pathway, you're an LD nurse, dual qualified, you've had a thought, perhaps I'll do mental health nursing. When did that happen? When was that kind of like, when was your exposure to that as an option or as something you wanted to do?
There was a few different circumstances that sort of led to it, and some of it was about the location where I was, and I didn't really have a lot of flexibility to move away at the time with the children and everything. It felt there was not a huge amount of opportunity to progress my career.
Okay.
I think that's very different for LD nurses now. I think there's a huge range of opportunities, but at that point I was quite painted into a corner. And there was also, where I worked, we had a combination of service users who would have very profound physical and learning disabilities, and some where there were certainly definite comorbidities with mental health issues and issues around behaviour and things like that. And I found that really interesting. And then I heard that the modified branch in mental health was being offered as a secondment, so I could remain employed as a staff nurse but do my mental health registration. So I thought, right, go for that. So that was how I got into it.
I sometimes find it a bit odd because we talk about mental health nursing, but what you've sort of said there is you were nursing people with learning disabilities, and obviously people with nursing abilities are humans and they experience human life as we do with mental health challenges. And sometimes we can get, I think, in nursing a little bit, you know, this is the adult field, they just do physical health.
Yeah.
This is learning disabilities, that's all we do. This is mental health nursing, that's all we do. And I sometimes think that's not necessarily helpful because the people we see have a range of needs.
What I say to our first years, and I work with the first years a lot, I say we don't just do the neck up, we look after the whole person. And again, in mental health, there are a lot of comorbidities, a higher incidence of physical health issues, so we really need to be very holistic. I mean, going back to my learning disability nursing, I was working with children and young people for 10 years. A lot of them had profound physical issues, and a lot of them had associated mental health conditions. So really, it felt like a foot in all camps before I even got to the mental health training. So definitely, I think you have to be very holistic across the fields. I know a lot of our adult field students are really interested in learning more about mental health now, more so than they used to be.
Yeah. So let's think about now, you're a mental health nurse, you've done your training.
Right.
Tell us a little bit about your sort of mental health career, where that took you,
Right.
The things you enjoyed, but also possibly we'll get into some of the challenges you had.
It's interesting because I was seconded, so I was an employee already. I really had to be put where I was put. I didn't get much choice about where I went, and I remember meeting my manager and she said, we'd like you to go and work with people with dementia, and like a lot of people who end up working in dementia, I just went, oh. And I felt it'd be more of the same, having come from learning disabilities, that actually there's I had a huge number of transferable skills that I could use. You know, in dealing with people whose cognition was impaired, in dealing with people who had comorbidities physically. But I felt like I really wanted to do something that was more pure mental health in a way, where I wasn't perhaps delivering physical care and taking people to the bathroom and all those additional things that I've been doing for a long time. So I applied to go and work in forensic mental health. So I went and worked in the regional secure unit for a while. And then one day I had a bit of a revelation driving along on my 20-odd mile trip to work on a wet Saturday afternoon, thinking, actually, I really liked working with people with dementia. I miss it now. So I applied to go back, having gained a lot of really useful experience in forensic mental health nursing, but I applied to go back and then went back to working in dementia care.
You said you missed it. What was that? What was that kind of? I miss it, and I can, you know, I nurse people at the in their later life, so I know what my answer is. I'm interested in yours.
Well, I had a conversation with a nurse who'd worked in that field for a long time when I first worked there, called Bev, and I was still a bit reluctant about working in that field. And she said, but it's so rewarding. And I was like, is it? And she said, you can give people a really good quality to their end of life. The difference between delivering good person-centred care, which was something I was really familiar with, having come from LD background, the difference between that and just delivering physical care, end of, was so huge. And I didn't get what she meant until I went back, and then I really realised how rewarding it was. Even though you know that those people have got a life-limiting condition, and at the point that we had them at that time, a lot of them were in end-of-life care. It was just really rewarding to know that you'd made little differences to people. And I really enjoyed that.
I think it's nursing for me is a really rewarding career. It's really clear in my mind that I go home when I've done nursing and I feel like I've achieved stuff, but it's not without challenges. You know, it's an unusual job that, you know, it's not necessarily a job where at the end of the day I've been thanked for my services and those sorts of things, but it's incredibly rewarding. What's something perhaps that you found challenging, and how have you dealt with that?
I can think of two things. One relates to my dementia work, by which time I was working in a day hospital, so most of the people that came to us were living with family members. And I think because of the nature of how the generation back then, 20 odd years ago, had lived, a lot of the gender roles were more distinct. So we had a chap who would come to us for the daycare, and his wife would come in frequently at the end of her tether saying things like, oh, I had to tax the car, I've never had to do that before, and I had to pay the bills, and you know, as someone who was doing all that and working and raising two children, it just seemed really funny. And I sort of used to roll my eyes a bit and think, oh, what is it now? And then I took a step back and thought, she's grown up in a different era, they had very distinct roles, and this isn't just about her having to do these things, it's every one of them is another moment of loss of her partner. And so I used to think, come on, think about what it's like from her perspective, try and have some empathy. And I used to sort of chat to her quite a lot. And I found it challenging because I had to change my perspective and my judgmental approach. But a few years later, after I'd left and long after her husband had passed away, I saw her in Tesco's. I was with my daughter and she came up and I just sort of had a chat and said, how's the family? And she got my daughter's arm and just went, I don't know what I'd have done without your mum. And it was just like, oh my God, you know, and yet I'd found it a little bit of a challenge to sort of change my mindset. The other thing I can think of is when I went from there to work in a community mental health team for working age adults. I found it very hard at first, having worked in teams. I mean, although I was in a team, you work more independently in the community, and I found it hard at sort of 5 o'clock in the afternoon or whenever I left off to then stop thinking about the people on my caseload and to switch off from work. And I had a fantastic manager at the time who always had her office door open and was, you know, really sort of receptive to having conversations and being supportive. And I remember going in one morning and I must have had a bit of a look on my face, and she went, "Are you all right, Ros?" And I went, "No." And she went, "In my office." And I said, what I'm having trouble with is not waking up at 3 o'clock in the morning worrying about people, whether I've done the right thing or said the right thing. And she gave me some really good advice on ways that you can just leave your work at work, you know, take off your work hat, go home and be your home self, and other ways to manage if I did have concerns about people, how I could talk to other members of the team at the end of the day, to just talk things through. And I haven't had that conversation. I never had to do that. It was just a reassurance of knowing it was there. But I think it's a really important thing that we do look after our own well-being as mental health nurses, because it is easy to take your work home with you. And I think we need to learn strategies and ways to manage how we deal with the stresses and concerns that we have during our working day or night.
Yeah, I think that's very relatable, that kind of feeling. It's a skill that I felt I developed, and it was probably an imperfect skill of finishing work and separating work from my private life.
Yeah.
I suppose that leads me into a question. You're being very reflective, so you're being really honest, and then you're talking very reflectively about how you dealt with some of those sort of personal challenges and how you sort of moved on to the next, sort of you progressed from there. Do you feel that nursing has changed you as a person?
I just think I've been a nurse for so long, I don't know what a person would have been like otherwise.
Is it part of your identity? Is Ros, when she's in her sort of personal life, is that part of your sort of
Oh, that's
makeup?
interesting. Again, I think it goes back to that being able to draw a line. And I think there are times where I've had to step away from that being my own persona.
Okay.
So, for example, it's particularly challenging when you work in a forensic setting because of the nature of some of the reasons people have come to that setting. So they may have committed offences that a lot of people would find quite unpleasant. But you have to see past that, look at the individual and think, what has led you to be suffering from this mental health condition? What's led you to be in the position you are today? What I found in my own life with friends and so on is when people behave badly towards me, I started to think, but what's led them to do that? And I thought, sometimes you just have to be able to say, no, I'm not tolerating that, end of. But I think that little bit of nursing was like, but what's led them to say that to me or to be in that mood? And I realised I've got to leave that at work sometimes.
And was that something that existed before, you know, if we wind the clock right back to the start of this interview, was that in you before you started your nursing career? Or was it something that was in you that sort of became more refined and developed as you went through your nursing career? That ability to sort of think and consider the person behind the condition.
I think there was some of it. I suppose having grown up around people with learning disabilities when they were very marginalised, and having to sort of take that non-judgmental approach to people and see them for the person that they are, not the diagnosis or the label that they've got. But I think it developed a lot more, particularly when I was working in forensics. But yeah, I did have to sort of sometimes draw the line in the sand. Otherwise, yeah, I'm just trying to think back to the original question now, but it's moved on.
No, I think it's really important. And I think when I reflect on my personal sort of health, it is a rewarding but challenging role. And therefore, for me to be effective, I need to manage that. I need to think of strategies to manage that.
That's the other thing that I was thinking of. I've had times in the past where I might not hear from a friend for a few months, and then suddenly, can you take me to the hospital? I've just had this diagnosis. Can you talk to me? And you just think... And it's a little bit like, I suppose, working with students, that we're there to teach. And if students need additional support, we have a myriad of services to provide that if they're having struggles, for example, with their mental health or whatever. With my friends, I try not to sort of allow myself to be drawn into them using me as their resident expert in all things healthcare. You know, I don't mind a quick question, but sometimes it can get a bit much.
Yeah, and I found actually that is quite an important point. Whenever I've tried to do that, it's always gone a bit wrong, and I think that's about having that sort of professional hat on, that professional role to offer advice, because there's a whole chunk of, if I offer advice to my friend, I haven't really done an assessment. I don't really know, so all I'm doing is offering some blanket advice that they could probably get off Google anyway. It's so much about knowing that person, and then you can kind of deliver some advice, perhaps. Yeah, fantastic. So, thank you. I'm not a nurse. I wouldn't be a nurse without you.
You're not a nurse? After all these years of fraud.
All these years. Yeah, but I believe I was your first personal advisee, so I should write you a written apology for that. But yeah, wouldn't be a nurse without you.
But there you go. I mean, that's another thing. It's all good learning experiences. I think without having you and your group as my first lot of advisees, I wouldn't have learnt some of the stuff I learnt about supporting students as I move forward. So it works both ways.
Yeah, you certainly learnt a lot from me. Okay, well, thanks ever so much for spending the time, and I hope that was helpful to people who are watching. Thank you.